Hi, welcome back to Transgender Research and Policy. This channel is really the product of my passion for social work and my master's training in evidence-based healthcare from the University of Oxford. And so today we're diving into three major new studies that are changing how we measure care, improve access to hormones, and tackle health disparities. As former Trump officials plot a nationwide ban on gender-affirming care, this episode brings you some of the latest science to push back with evidence, not fear. From new validated clinical tools to the first randomized trial on testosterone therapy, these studies arm clinicians, researchers, and advocates with what they need right now. So let's get to it. First, on the policy landscape, a recent Associated Press investigation reveals that a group of former Trump HHS leaders, Health and Human Services, including Roger Severino, are preparing an aggressive legal and administrative strategy to prohibit gender-affirming care for minors, criminalize physicians, and define, in quotes, gender transition as fraud. Meanwhile, RFK Jr.'s third-party run is siphoning votes from both Biden and Trump, and he's aligned himself with fringe views on trans care, raising serious alarm bells for LGBTQ plus health equity. And so today we're covering three groundbreaking studies that are reshaping the landscape of transgender research, clinical care, and policy. First up, Kaur et al. 2025 developed the gender Q. So for years, patient-reported outcomes in gender-affirming care have been pretty poorly measured. Most tools were adapted from cisgender-focused surveys, which missed the unique experiences of transgender and gender-diverse people. Kaur and colleagues closed this critical gap by developing the Gender Q, very rigorously validated modular survey specifically for transgender adults across multiple countries. And they developed it with data from nearly 5,500 participants, and it covers physical outcomes, emotional well-being, social functioning, and satisfaction with gender-affirming interventions. And this matters because it sets a new gold standard for outcome measurement in clinical research, clinical care and research. And clinical social workers and other mental health professionals can now rely on culturally appropriate patient-centered data when accessing care satisfaction and assessing care satisfaction or advocating for services. And researchers can apply it to evaluate policy reforms and quality improvement initiatives internationally. The citation is development and assessment of a patient-reported outcome instrument for gender-affirming care, which is in JAMA Network Open, Volume 8, Issue 4, Article 254708. Next, we're going to talk about Nolan et al.'s article published in 2024, talked about testosterone therapy and quality of life. So access to testosterone has long been linked to better mental health for transgender and gender diverse people. But until now, we lacked randomized clinical trial evidence. One of the biggest critiques against gender-affirming medical care has been the lack of RCTs. So Nolan and colleagues performed the first such study showing that early testosterone initiation significantly improved self-reported health scores in just 3 months compared to delayed access. And so this matters because it provides strong evidence for early hormone access policies, which are crucial in advocacy against waiting periods. Clinical social workers and mental health professionals can use these findings to support insurance appeals and guide case management around transition-related care. And researchers can build from this to validate better quality of life metrics tailored for trans populations. And so the title of the article is Testosterone and Quality of Life in Transgender and Gender Diverse Adults Seeking Masculinization. And it's in JAMA Network Open, Volume 7, Issue 10, Article E2443466. The third article we'll talk about today regards health disparities in the Danish transgender population. And finally, a massive national cohort study from Denmark shows that trans people face 4 to 12 times higher odds of both mental health issues and physical illnesses compared to cisgender peers, even in a country with universal health care. Glintborg and colleagues found especially elevated rates of mood disorders, autism spectrum diagnoses, diabetes, asthma, and chronic pain. And this article matters because it highlights that health disparities persist even when healthcare access is equitable, which points toward the effects of gender minority stress. So social workers and other mental health professionals can integrate mental and physical health interventions holistically. Policymakers and researchers must address societal discrimination as health determinant, not just access barriers. And so, as I may have mentioned, the article is titled Mental and Physical Health Among Danish Transgender Persons Compared with Cisgender Persons, also in JAMA Network Open, Volume 8, Issue 4, Article E257115. And so overall, these studies signal a major shift toward evidence-based, patient-centered transgender care. Whether you're a clinician, researcher, or policy advocate, these findings empower better practices and stronger arguments for equitable, affirming care. Thank you for tuning in. Stay curious, stay critical, and let's build a future where research drives real change. If you found today's research updates helpful, make sure to like, subscribe, and share with others working to build more equitable, evidence-based care for transgender and gender diverse communities. Until next time, stay informed, stay empowered. This is my kitty, Minnie, who often likes to join me. Thank you.